All right, good morning, everyone. Let's get started. Before we get started, a couple of things I want to say. First of all, whoever is on the Galaxy tab, I need to know who you are so I can make sure you get credit for the hours for being here. So if you want to like throw your name in the comments on the chat box on the side or something, but I need to know who all is in these web meetings so that I can make sure you get credit for those hours. The second thing I want to say is I will be getting everybody's progress reports together here in the next week or so. So once I get progress reports together, I'll give you guys a call on the phone. We'll go over your progress reports and we'll go from there. But today we are going to get started with the muscles of the face, torso, and spine. So we are going to be working out of our trail guides. So make sure if you guys do not have it already, make sure you guys have grabbed your trail guide. We are going to be opening up to the beginning of the spine and thorax. It starts on page 168 and 169. Now, this is going to be a little bit of a challenge, you guys, because normally when we teach muscles, we are all in a class together. So we can all stand up and we can move around and we all see each other. This is going to be a little more challenging since we're all doing this at a distance. So I understand when you go into MindTap and you look at what is due for the week, it is not a lot. All right, I understand there isn't a lot of material that you guys are having to turn into me, but make no mistake, there is going to be a lot of studying to do. There is a face, torso, and spine test that I've got up on Classmarker that you guys will have to take, just like you did the pathology test. But before we get there, I'm not exactly sure how long this is going to take us. So initially I'd thrown that test up saying that it was due on Sunday, but I'm not positive that we're going to be able to get through all this material by Sunday. So I took that test back down. We may have to continue these lectures on into next week. I'm just not sure. But please make no mistake, you will need to study. You will need to if you've gone through that packet, I would suggest you turn around and you do that packet again, because we are going to cover a lot of material and I don't have a lot of things in terms of handouts. So I have uploaded the entire trail guide packet that I have with all this, the diagrams for all the bony landmarks and the muscles. I also have uploaded this slideshow that I'll be going through today. So you guys will have access to all of those slides. I will be creating activities and uploading them for you guys to do. So just keep your eyes out. What you're seeing on there right now is going to change as the week goes on. I will be adding more material. So keep your eyes peeled. Make sure that you're checking every day on MindTap to see if any new assignments have been added, and make sure you get those into me by the due date. Good stuff. Any questions? Awesome. Let me check real quick. Hold on one second. I still need to know the name of whoever else is logged in. I have you, Nando, Crystal, Sandra. There is a fourth person in the class. I need to know who you are so I can make sure you get credit for being here. All right, so let's go ahead and get started. Starting out with a general kind of topographical view, we're just kind of looking at the general overview. What can you see when we just look at a person's body? A few of the major landmarks that we can spot looking at the anterior view, we can see the sternum, the breastbone. It's right in the center of the chest, right in between the pecs. It's a hard, bony, kind of flat ridge. We can also see the jugular notch. The jugular notch is this little depression. When you press your finger down onto it, you are touching the jugular notch of the sternum. We can also see a few of the ribs here along the side. We can see the end of the rib cage, this kind of inverted V shape. We can see the abdominal muscles, right? Those classic washboard abs, that is the rectus abdominis muscle. We can see the external obliques, these muscles that kind of come in at an angle, giving you that nice cut V at the hip line. We can also see the umbilicus, the belly button. On the posterior view, we can see the most prominent of the spinous processes. The largest, easiest to spot bony bump coming from the vertebrae is going to be the spinous process of C7. You just take a hand, kind of stick it on the back of your neck, roll your fingers around a little bit. Your fingers will find it. It is the most prominent bump. That will always be C7. We can see the spinous processes of the thoracic and the lumbar vertebrae, as well as the medial border of the scapula. So you can see kind of the shape of the scapula. We see the medial border. We can see the inferior angle here as well. The iliac crest is the hip bone that you see right over the gluteal line, and then right above the dimple at the very top of the gluteal cleft, we can see where the sacrum will sit. So that just gives you kind of a general outline of what we can see. Now moving on, we have the exploring the skin and the fascia. We're going to move on past this. I've got a lot to cover, so we're going to move on ahead. All right. Looking into the spine, as we know already, the spine, the vertebrae are not named. They are numbered based on their section. So we have the cervical vertebrae in the neck. There are 7 of them. In the thoracic spine, we have 12 vertebrae. There are 5 in the lumbar region. So we name them C1, C2, C3, C4, T12, L5, and so on. All right. On the anterior side, we have the sternum, which will be divided into 3 parts. We will talk about those in a few minutes. We can see the ribs as well as the costal cartilage. The rib cage is not bone all the way around. At a certain point, the bone transforms into cartilage, and then these cartilage trunks come in and actually connect to the sternum. We see the anterior aspect of the lumbar vertebrae and the sacroiliac joint. Again, this slideshow is on MindTap already. I've already uploaded it. So I know I'm moving a little fast, but you have this entire slideshow available to you. So you guys can kind of take your time. Also, these photos are also in your trail guide as well. So, all right. Now, your trail guide is going to go ahead and jump into vertebrae. However, I have a little bit of an issue. When we are talking about vertebrae, now, I don't know if you guys are mostly Clearwater students. You guys know how I am with bones, right? You know, like bones are my thing. So when we're talking about vertebrae, it's generally easier to start with a lumbar vertebrae because there isn't anything special about a lumbar vertebra. They're just big, right? They have all of the main parts that we would expect to see on a vertebrae. As you move up in the spine, you move to the thoracic vertebrae, we start to see new features develop, because thoracic vertebrae have to do something that none of the other vertebrae have to do. Let me go back just a little bit. If you look at the spinal column, you notice that as you move into the lumbar spine, these vertebrae become very large. These are because they are weight-bearing. All of the weight of the upper body is balanced on this column of bone. So these vertebrae must be very large, must be very robust, in order to support all of that weight. As you move into the thoracic spine, these vertebrae are doing something that none of the other vertebrae have to do. They have to attach to ribs. And as you guys have probably seen with bones, anytime 2 bones come together to make a joint, there will be a mark on the bone that shows where that joint takes place. So since each of these vertebrae is connecting to a rib, there is a small flattened area, a facet, where that costal will attach. It is called a costal facet. Only thoracic vertebrae attach to ribs, therefore, only thoracic vertebrae get costal facets. So we see a new feature added onto the standard template that we will start with a lumbar vertebra. As we continue to move up in the spine, we reach the cervical region. There are no more ribs. So cervical vertebrae do not have the costal facets that thoracic vertebrae do. But cervical vertebrae only have to support the weight of the head, which is generally usually only about 8 to 12 pounds. So these vertebrae are much, much smaller. But because they are doing something a little bit different, they have to have a different amount of range of motion than any other aspect does. They attach to each other a little bit differently, so the bones are shaped a little bit different. They get a couple of extra features that the other bones don't. Now, why am I going through all of this? Here is why. Your trail guide starts you at the top with the two bones that are the exception to the rule. These are the ones that don't follow the rules. They are very different from all the other vertebrae. It is much easier to learn the bony landmarks of the vertebrae starting at the bottom with lumbar vertebrae that don't have anything special about them. You learn the basic template, and then you move up and you start adding and subtracting features from your base template. So I am going to actually skip ahead to the lumbar vertebrae, and then we're going to work our way backwards to the first two cervical vertebrae. So I'm going to slide down to cervical, thoracic, and lumbar. Here we go. There we go. All right. So here is a typical vertebra. This is a lumbar vertebra. If you were to pin me down, I would say that is about probably L4. Just showing off. So when we look at a typical vertebra, here are some of the major things that we see. First things first, we have a huge solid section of bone. This is called the body. The main part of any bone is generally going to be called the body. We have a very large hole that naturally occurs within the vertebra. A hole in a bone is called a foramen. Foramen. One is a foramen, plural is foramina. This foramen is common to all vertebrae. Every single vertebra has this hole in it. It is threaded through the spinal cord, right? So almost like putting beads on a necklace, all of these vertebrae are beaded onto the spinal cord, which then stacks vertically. So this foramen that is common to all vertebra, vertebral foramen. Next, we have these projecting pieces of bone that stick out to the side. Now we are looking at the superior view. So you are looking at the bone straight down. So when this is in anatomical position, these projections on either side are sticking out horizontally in the transverse plane. Transverse process. A transverse process. The posteriorly facing projection is the spinous process. This is the one that you can palpate when you're touching a client's back. You feel those little bony lumps all the way up and down the spine. You are feeling the spinous process. Rising up from the superior aspect, we have the superior facets. A facet is a flattened area on a bone that is used as part of a joint. If it is a flat area on a bone and it is not used as part of a joint, we are not going to call it a facet. We're going to call it something else, right? Probably a ramus. But if it is a facet, it must be used as part of a joint. We can see these superior facets sticking up here. We can also see down here, we would have inferior facets. So this inferior facets from the vertebra above will join with the superior facets from the vertebra below. Those two facets will touch each other. That gives you a gliding synovial joint, right? A flat shaped joint that moves in the cardinal planes. From the lateral view, we can see again the body, the transverse process, which is sticking directly towards you. So it's hard to kind of see, you know what I mean? It's hard to see how long my arm is when I'm holding it like this. And that's exactly what you're seeing here. This transverse process is pointing directly at you. And then we see the large, fin-like spinous process. The last landmark that we see is the lamina groove. Now this one can trick you. The lamina groove isn't a landmark per se. It is just the groove, just the kind of the notch that is created by these two projections. So if you would imagine this was a solid piece of bone and I just took a carving knife and just kind of carved out this little section here, this is the lamina groove on both sides. It is called the lamina groove because it is a groove sitting in front of this connecting piece of bone. This is the lamina. The lamina is this bridge of bone that connects the transverse process to the spinous process. So we have the lamina, and then we have the lamina groove. This is the basic template for a vertebra. All of the vertebrae are going to have these main features involved, kind of as a rule. Now, as we move up in the spine, we move up to a typical thoracic vertebra. Now again, thoracic vertebrae have to do something that lumbars don't. They have to attach to ribs. So we need a landmark that shows where these two bones attach to each other. The additional feature that we add to the template only for thoracic vertebrae are the costal facets. Costal facets. They are on the posterior aspect of the body. One is on the superior aspect, one is on the inferior aspect. And just to be clear, we have a superior bilaterally. There is one on the left side, one on the right, and the inferiors are also bilateral. So each vertebrae will have 4 costal facets, 2 superior, 2 inferior. All right, but everything else that we would expect to see in a vertebra is still present, right? So we have a body, we have a vertebral foramen. For thoracic vertebrae, note how very round this foramen is. On the lumbars, they were kind of triangular shaped. Here we see them get a little bit smaller and much more round. Extremely prominent transverse processes, the single spinous process, and again, the lamina. The lamina is just this connecting bridge of bone. We also have the lamina groove, very beautifully carved out for us here. And another interesting thing that we see is the spinous process. The lumbar vertebrae had a very broad, kind of fin-like spinous process, but here in the thoracic spine, we see that they don't stick out directly posterior, they kind of angle downward. The reason here is since these are connecting to ribs, thus creating the rib cage, which is designed for structural support, we don't want a lot of movement happening in the thoracic spine. So by angling their spinous process downward, you end up with these things kind of, as they, I'm trying to, how do I word this? By angling the spinous process downward, we reduce the amount of movement, right? They kind of interlock with each other. So the thoracic spine doesn't have a whole lot of movement compared to the lumbar or cervical spine. Remember, we don't want a lot of movement in this part. The rib cage is meant to stay kind of solid and structurally supportive. So this is just one simple trick. We angle the spinous process downward, therefore we greatly reduce the range of motion that the thoracic spine is capable of. So again, same basic template, same basic bony landmarks. The only new feature that we see are the costal facets. Now moving up into the spine, we now reach the cervical region. So we will still have the same basic landmarks. However, we lose costal facets because there are no ribs in the cervical spine. So that feature goes away. But we also see this vertebra does not look like we have seen before. Cervical vertebrae have special features because they have extra functions. We've got very important blood supply going through these vertebrae to get up to the brain. So we want to make sure that this blood supply is very well protected. The vertebral artery runs through special foramina that exist only in cervical vertebrae. These foramina, which we see here and here, when these vertebrae are in situ, in place in the body, there will be the vertebral artery running through those, again, like beaded onto a necklace. The vertebral artery runs through these foramina up into the brain. These foramina, since they sit on either side, kind of horizontally, are called transverse foramen. Transverse foramen. We only see transverse foramen on cervical vertebrae. So again, we have a body, as we would expect. We have a vertebral foramen. We have a spinous process. We also have the superior facets. We would have the inferiors underneath as well for them to attach to each other. Here we see the transverse process. Now this one may take a little bit of an imagination here, but if we kind of imagine, here is where the main part of the bone is. So everything over here, this entire piece of bone, that whole thing is the transverse process. I know it's weird, we got a die mad about it. This whole thing is the transverse process. We have an anterior tubercle and a posterior tubercle, just small bumps on a bone, little muscles will attach there, give you some flexibility and movement in the cervical spine. Again, we have the lamina and the lamina groove. This small recession here, again, if you look at it here, we see how it kind of dips downward. This is known as the canal for the spinal nerve. This is the exit point where nerves from the spine, when they pinch off and then exit, they are kind of cradled by bone. They exit here, there's a whole nice little groove, and then this little canal that they can exit through to go out into the body and, you know, do nerve stuff. So we are starting to pick up a few extra features. And again, we don't name vertebra, we number them, right? C4, C5, T1, T12. When we get into the thoracic vertebrae, the vertebra T1 connects to the first ribs. So T1, rib 1, T2, rib 2, T12, rib 12. Now, as we go up into the very first two cervical vertebrae, C1 and C2, these guys are the exception to the rule. These don't follow the rules. This is why I saved them for last, right? You don't want to start somebody out learning this stuff by teaching them the exceptions to the rule. You start by teaching them the rule and get them used to what's going on. And then you break away from convention and show them the exceptions. So starting with C1, we are, again, very, very top. This bone articulates directly with the occipital bone, right, the base of the skull. A few things that we notice right off the bat. Number one, there is no body. There is no body. This thing looks like a big donut. We have very large superior facets, which will articulate with the condyles of the occipital bone. A very large vertebral foramen. We have two transverse foramina that we would expect to see on a cervical vertebrae. And then we have these kind of triangular, pinched out processes. These are the transverse processes. Here is the lamina, again, this connecting piece of bone, but it doesn't lead to a spinous process. There is no spinous process. All we have is a small bump on the posterior side, the posterior tubercle. So we've lost the body. We've lost the spinous process. We've lost nope, that's it. We lost those two. There we go. One more little thing I want to point out. Here we have the groove for the vertebral artery. It is really difficult to understand what is going on when you're looking at it this way. But if you look up here, you notice there is a slight groove right here. The vertebral artery will come out of the foramen and then snake under this towards the vertebral foramina and then head straight upwards. So it kind of merges, not merges with, but it uses the same tunnel as the spinal cord to get up into the brain. So it goes through the foramen magnum, the big hole at the base of the skull. Those vertebral arteries go through the transverse foramina all the way up to C1. Then they take a sharp medial hook through the groove for the vertebral artery, into the vertebral foramen, and then up into the skull. One more little thing. We said that this guy does not follow the rules because we've lost the body, we've lost the spinous process. Another rule that these first two vertebrae break, we do actually name these two. So the name of C1 is the Atlas. Yes, that Atlas, the same guy from Greek mythology, right? He held the world up on his shoulders. You usually see him like holding a globe up or something. Atlas was a Greek titan who defied Zeus, and Zeus cursed him to hold up the sky for eternity. So this is the guy like holding up the sky. We call this bone the Atlas because it is the bone that supports the globe of your head, right? The entire skull sits right on this one bone. So this is the Atlas. The next bone inferior is going to be C2. This is known as the axis. It is given this name because of this prominent projection here, which will connect to C1, creating a pivot joint. Now I know we're throwing you guys way back to skeletal system. A pivot joint was a joint between two bones that allowed rotation around an axis, such as this movement right here. You see how my head rotates around a central axis? You see what I did there? We named it the axis because this is the bone that provides the axis around which the skull can rotate. This projection is something new. We only see this projection on this very bone, which is another reason why this one breaks the rules. It is known as the odontoid process. Odontoid process. That is its Greek name. The odont, if you've ever gone to an orthodontist, it means tooth. It is a tooth-like projection. And it is roughly about the size of one of your central incisors or maybe one of your molars. It's a pretty decently sized projection for this bone. Now, granted, this bone is like that big. So when I say decently sized projection, it's relative. Now, welcome to anatomy. Everything has 5 different names. You just got to die mad about it. Remember, we named everything in Greek, and then we named everything in Latin. So in Greek, we called it the odontoid process, right? Odont meaning tooth. Well, in Latin, we simply call it the dens. Now, why would we jump to a word like dens? Well, if you've ever gone to a dentist, you see where we're going with this? We did the exact same thing. It is the tooth-like projection in Greek, and it is the tooth projection in Latin. We are using 2 different words to describe the exact same thing. A tooth-like projection, the odontoid process, or the dens. Both of these names are fully acceptable. It does not matter which one you use. They both mean the exact same thing. So if you like to keep things easy on yourself, call it the dens. You will still be correct. Now that we are in C2, we start to go back to following the rules, right? We have all of the same landmarks that we have come to expect. We have a vertebral foramen. We again have a spinous process. So only C1 did we do away with those 2. If you turn this bone upside down and look at the inferior view, it does have a body. So we are back to having bodies and spinous processes. We also have the transverse process. Is this entire projection of bone on the other side of my hand there. There we go. This whole projection is the transverse process. We have superior facets, vertebral foramen. We have the lamina, and of course the lamina groove. One thing that I want to point out on the lateral view, it points to the vertebral foramen. This is a bit deceptive when you're looking at a hole in a bone, but you're looking at it like this. So the vertebral foramen, it's pointing down, but it doesn't look like you're pointing to anything. Remember, it's pointing to a hole. You just can't see it from that lateral view. So that was down and dirty bony landmarks of the vertebrae. You are lucky I am recording this lecture. It will be posted on MindTab for your later viewing pleasure. I feel like you're gonna have to watch this video over and over and over again to get all these landmarks down. But I do have to move on. We have a lot of material to cover, as I said. So I'm going to go back down to the next section, which is the rib cage and the sternum. So when we look at the rib cage, we are looking at a grouping of bones. We are looking at about 37 bones, some odd, all creating this complicated structure which encloses the heart and lungs. So let's start up at the top. When we look at the ribs, we have 12 pairs of ribs. 12 pairs, which means we have 24 ribs total. Ribs are not named, they are numbered. So if we were to give one of these ribs its full proper name, we would say the left first rib, or the right 12th rib, or the left 8th rib. That is their name. There you go. So you have less vocabulary to learn. Now, when we look at ribs, we group them based on certain features that they have in common. We come up with 3 main groups. The first group are called the true ribs. If you look at this image at the bottom, the anterior view, this is where they get their names from. If we look at the first rib starts on T1, it swoops around and connects directly to the sternum. The second rib comes around and plugs directly into the sternum. Same story with ribs 3 through 7. Rib 7 swoops around and connects directly to the sternum. They truly connect to the sternum. They are true ribs. Okay? Ribs 8 through 12. I'm sorry. Ribs 8 through 10. This number is wrong on the slide. Make a note of that. Ribs 8 through 10 are called false ribs. They are false ribs because they do not truly connect to the sternum. When those ribs turn into cartilage, the cartilage merges into a single trunk, which then merges with the cartilage from rib 7. So they join rib 7's cartilage into the sternum. They do not truly connect to the sternum. They are false ribs. The last 2 ribs, ribs 11 and 12, do not connect at all to the sternum. They start on the spine, yes, but they jut out like a diving board, just sticking out into space. They are the floating ribs. Now, why would we want ribs connected to the spine on the backside, but that don't connect to the sternum? We go back to the first function of the skeletal system, protection. Bones are hard, therefore they protect things. There are 2 vital organs sitting right there. Those are your kidneys. Kidneys filter your blood. So guess what they're full of? Blood. So if one of these bones, by sticking out over the kidney, they allow an extra degree of protection. This is why in boxing or martial arts, punches to the low back are an illegal move, because if you puncture a kidney, those things are full of blood. You puncture one of those things, they bleed out very quickly. So like throat punches, groin punches, kidney punches, there are certain things in sports fighting that are illegal. And trying to punch someone over the floating ribs is one of them. These bones are very small, they are thin, they are not very difficult to break. If you were holding a 12th rib in your hands, you could snap it. They're not that difficult to break. But they do offer a large degree of protection to the kidneys. That is why they are there. You guys, please, as always, stop me if you have any questions, okay? I know I'm moving fast, so if you have any questions, stop me. Now, 12 pairs of ribs. Guys, this is the same for men and women. Men do not have one less rib than women. That is not how this works. Everyone has the same number of ribs. Next thing is the sternum itself. Now, the sternum is a flat bone. It starts its life in 3 separate pieces, and as you develop, usually in your early to mid-20s, the sternum completely fuses into one solid bone. but we still name the parts of the bone as the original parts when it was separate. So altogether, we have the sternum, one bone, the sternum. The top portion here, it looks kind of like the tie on a necktie, is known as the manubrium. Manubrium. I'll explain that in just a sec. Here we have the main part of the sternum. Again, the main part of a bone is going to be called the body. So we have the body of the sternum. Right between the manubrium and the sternum, we have a horizontal seam where these two bones fuse together, and there will still be a ridge visible on the bone where those two sections of bone grew together. This is known as the sternal angle, or the angle of the sternum. If you run your finger over it, you can feel a slight raised projection. This is one you can feel on yourself, right? So start with the jugular notch, right? When you move your finger down, you're on the manubrium. Now slide your finger up and down, pulling the skin with you. You're feeling the texture of the bone. When you get about 1.5 inches or so, you will feel a horizontal ridge. That is the sternal angle. Once you move inferior to the sternal angle, you are now on the body of the sternum. And if you keep following it down, right where the ribs come in to join the sternum, just inferior to that, you will feel a very small bony projection. That is known as the xiphoid process. The xiphoid process. It's one of my favorite words, xiphoid. Now, normally I have this on a whiteboard, so I can grab one of my dry erase markers and I can like write and draw. I tried to get it set up before I started the lecture, but guys, the light of the projector was just so bright on that whiteboard and it was like throwing off my camera. So I had to bring my projector screen down. So I can't draw on this the way I would normally want to, but follow me on this one. The name xiphoid process is Latin. Xiphoid means, I'm sorry, it's Greek, not Latin. I'm sorry, it's Greek. The word xiphoid means dagger-like, right? Like of or resembling a dagger. So here we have the point of the dagger, we have the blade of the dagger, and then on the manubrium, imagine here if we had two little hand guards and a handle attached to it. So we would have the handle, the blade, and the tip of a dagger, right? Manubrium is a Latin word. It means handle. Handle. So the word manubrium, if you guys speak Spanish, the word for hands is manos. If you have to do something by hand, you say you have to do it manually. This is where we get that word from. The word manubrium means handle, something you grip with your hand. It is the handle of the dagger, of the xyphus. There you go. Etymology is fun, kids. Okay. Any questions about what we've done so far? All good?
A question.
Please.
I kind of walked in late, but when you were talking about the false lip ribs, it says 8 through 12.
Yes.
I
have an issue with that. It's 8 through 10. It should be 8 through 10. You got true, false, and floating. Floating are the last two.
Mm-hmm.
I know they're kind of lumping the floating ribs in as false ribs. I mean, we could debate it, but it is easier on you guys to just 1 through 7 are true, 8 through 10 are false, 11 and 12 are floating.
Okay.
Just keep it easy on yourself.
Okay.
Good question. By the way, who is this? New phone, who dis?
This is Coral.
Coral, awesome. I want to make sure you get credit for being here. So when you come up on my thing, it just says owner. So I just want to know, I want to make sure you get credit for being here.
Huh, okay.
All right. Good stuff, good stuff. Moving right along. When we get to ribs, I'm not going to spend a lot of time on ribs as massage therapists. This is just not really relevant to us. But I will tell you, being like a forensic bone guy, ribs are awesome. And by examining the ends of the bones, the sternal ends of the bones, you can estimate a person's age when they died based on the condition of the rib ends. It's one of the many features that we can use to age a skeleton and tell you how old this person was when they died. Fun fact. All right, moving on, moving on, moving on. We've got palpation trails. I'm not going to walk you guys through those. Again, this whole slideshow is already uploaded to MindTap. So I know I'm breezing through some of these things, but guys, I'm telling you, read every page of the trail guide, go along with the slideshow. That handout that I've put on there, do it like 3 times, guys. This is a lot of information. Normally, we would spend hours and hours and hours in class throughout the about 2 weeks going over this stuff. I only have you for 2 hours twice a week. So this is a lot of material you guys are going to have to study on your own. Okay. So as we move into the muscular portion of this lecture, there are a few things that I would like to remind you of that will make things a little bit easier for you as you move into the nuts and bolts of this section. What I would like you guys to keep in mind, when you are working with muscles and you are being asked what action does a muscle do, it is not necessary that you memorize every action that every muscle does. There are cheats that you can use, right? There are rules of thumb that you can apply. So if you know where the muscle is on the body, right? If you can just look at a muscle diagram and point to the muscle, there are certain things that you can tell about the muscle just based on where it is, all right? The first thing is muscles that do flexion tend to be on the anterior side of the body. So when we are looking at something like rectus abdominis, if I say, what is the action of rectus abdominis? If you know that it is on the front of the body, you are 99% certain flexion is on its menu of services. If a muscle is on the posterior side of the body, they tend to extend, okay? So anterior muscles flex, posterior muscles extend. Hi, Janice. Thank you for letting me know. All right. Anterior muscles flex, posterior muscles extend. Just knowing that helps cut down multiple choice questions when they say, what is the action of this muscle? If you know what's on the front and extension is one of the options, you can cut that right off your list, okay? Muscles that are lateral, like the deltoid, abduct. Lateral muscles abduct. Muscles that are more medial, for example, latissimus dorsi is on the medial side of the arm. Medial muscles adduct. Think about the thighs as well. Muscles on the medial side of the thigh. I'm not going to lower my camera down, but muscles on the medial sides of the thigh pull the legs into the midline. The muscles on the lateral side of the thigh pull the legs into abduction. Next tip. Looking at the direction that the muscle runs in will also tell you something about what that muscle does. So if you look at the muscle fiber direction, muscles that run up and down tend to flex. Think rectus abdominis, think bicep, right? Muscles whose fibers run horizontally tend to AB and adduct. Think pec major. Pec major's fibers run horizontally across the chest. It is a horizontal adductor. Adductor. Pec major, horizontal adduction. Now, you may say, Dave, pec major has fibers that run in multiple directions, right? Because these lower fibers go up to the arm and the upper fibers go down and then they kind of twist. And I would say, you are correct, but the rule still applies. Those fibers that go in one direction or another do that one action or another. So these fibers that go up pull the arm down into extension. The fibers that run down, right, the upper fibers of pec major, pull the arm up into flexion. When all fibers contract, it horizontally adducts. So if I know the fibers of this muscle run in 3 directions, then I know this muscle must have 3 actions. Agonists and antagonists, we know that they occur in pairs. They also tend to occur on opposite sides of the same part of the body. Think bicep, its antagonist is tricep. Flexors, their antagonist is extensors. Cervical flexors, their antagonists are cervical extensors. So if you are asked, what is the antagonist of rectus abdominis? I don't have to run through a list in my head. What major muscle is on the exact opposite side of the torso? If you said erector spinae, ding, ding. So it's not as much about memorizing every little detail about muscles. It's learning rules of thumb that will lead you to making a good guess on the test question. And those guesses, 9 times out of 10, you guys will be correct, okay? Another tidbit, muscles that run at an angle, right? Think obliques or think lower trapezius or deltoid, right? In anatomical position, those muscles whose fibers run in an oblique angle tend to cause rotational movements. So latissimus dorsi is a rotator. When we are looking at the obliques are torso rotators, right? If you look at the sartorius muscle in the thigh, this diagonal muscle that runs across your thigh, it is a rotator of the knee. So again, you don't have to memorize every muscle and every action. You learn rules of thumb that carry you to logical conclusions. If you are asked, what is the action of this muscle? All I need to know is generally where does that muscle fit onto the body? What direction does that muscle go in? You can generally take a solid guess at what actions you can get out of that muscle. And again, if a muscle runs in multiple directions, like remember we have 3 separate fibers of the deltoid, that tells me I must have 3 separate actions, right? Anterior deltoid flexes, posterior deltoid extends, all of the deltoid abducts. Good stuff? Good stuff. Do not think you have to memorize every single detail. You will break your brain. It's too much. Let my laziness guide you. I am so lazy, I will find the quickest way of getting whatever I need. And I'm telling you, rules of thumb will carry you very far in the muscle world. All right. So we are going to move on into our first muscle group. We are looking at the erector spinae muscles. In your trail guide, we are on page 196 and 197. 196, 197. We're making good time. The first muscle group is the erector spinae group. Now, as with everything else in medical terminology, you guys, let the words talk to you. Let the words tell you what they are trying to tell you. Erector spinae group. Group tells me it's a group of muscles, so there's more than one. They are attached to the spine, and they help the spine remain erect. Now think about this. if I am trying to make my spine erect, am I pushing this way or am I pulling this way? You are pulling this way. This is extension, right? The erector spinae are also on the posterior side of the body. Therefore, what action do I know that they will perform? Extension. They are posterior muscles. They will extend. That's it. So, from medial to lateral, your three erector spinae muscles are the spinalis. Spinalis is closest to the spine. Longissimus. The longissimus is very long. It runs from the sacrum around the iliac crest all the way up to attach to the mastoid process. From the hip to the ear, this muscle runs. From the hip to the ear, that is very longissimus. Lastly, we have the iliocostalis, from the hip and then inserting onto each rib, from the ilium to the costals, iliocostalis. The way I like to remember these, I love food. You guys know I married a chef. I love food and I will eat anything all the time forever. I love spaghetti. I love spaghetti. I love spaghetti. From lateral to medial, iliocostalis, longissimus, spinalis. I love spaghetti. Now, several of these muscles, each muscle, like the spinalis or the iliocostalis, a lot of these are subdivided, okay? We would simply add a last name onto that muscle to specify where that muscle went to school. So if we have spinalis, right? One muscle, spinalis. But this muscle is split into two sections. We have the spinalis cervicis, the part that's over the cervical spine, and then spinalis thoracis, the part over the thoracic spine. I also just want to point out these muscles are bilateral in real life. They only illustrated one on each side to show you the muscle, but in real life, there are two of each one on both sides. Just throwing that out there. So spinalis has two kids. We have spinalis thoracis, spinalis cervicis. Longissimus also has a couple of kids. We have longissimus thoracis and longissimus capitis. Capitis, like where you wear your cap, this one actually connects to the skull, right at the base of the skull. Iliocostalis, from the hip to the ribs, we have iliocostalis lumborum, the region just in the lumbar spine. We have iliocostalis thoracis, only found in the thoracic spine. And we have iliocostalis cervicis. It attaches to the base of the neck. It does attach into the thoracic spine, but because it starts in the neck, that is where we get its name, cervicis. So cervicis is telling you neck, capitis is telling you skull, right, where you wear your cap. So when you are doing massage, you can palpate the erector spinae muscles. These are those two thick rope-like muscles on either side of the spine. So when you're doing a stroke like this, you're using the heels of your hands to go down on either side of the spine. These are the muscles you're hitting. All right. So in your trail guide, on page 196 and 197, on the erector spinae page, I want you to highlight the first sentence. The erector spinae group runs from the sacrum to the occiput along the posterior aspect of the vertebral column. I want you to highlight both of their actions. These muscles, when they contract unilaterally, what we mean is when we have one side that contracts but not the other. So let's say only the right side of the muscles contract. It causes the spine to turn to that side. This is called lateral flexion. So when one side contracts, we laterally flex the vertebral column to the same side, right? The right side contracts, we lean to the right. If the left side contracts, we lean to the left. This is known as ipsilateral. Ipsilateral flexion. Ipsilateral means to the same side, right? Its opposite would be contralateral, but we'll get there. When these muscles contract bilaterally, so both sides of the muscle contract, we extend the spine. Both sides contract, spinal extension. Make sure you also note, I love spaghetti. From lateral to medial, iliocostalis, longissimus, spinalis. Spinalis is closest to the spine. Iliocostalis runs from the ilium to the costals, from the hips to the ribs. Moving on to the next muscle group, we have the transversospinalis group. Very fancy word. I love this word. Let's break it down. Transverso, in the transverse plane, we are looking at muscles that traverse the spine, especially these rotatories. I call these the shoelace muscles. This is a group of small muscles. They're usually only about 1 inch or 2 long each, and they connect one vertebra to the next. And when these all contract together, it allows different variations of rotation in the spine. They also assist with stability as well as with extension. But generally speaking, we have the rotatories, we have the multifidi, and then we have semispinalis capitis. Semispinalis capitis starts on the occipital bone, it runs down and then connects to various vertebrae. So multifidi, rotatories, and semispinalis capitis. And these are, like I said, shoelace muscles. Think about really high boots. You gotta like lace up those boots all the way up to your knees. This is how these muscles are operating. They lace up the vertebrae, crisscrossing, so that we have multiple connections so that each vertebra can rotate relative to others. I want you to highlight under semispinalis capitis on page 201, highlight its action. It extends the vertebral column and the head. Highlight its origin, C4 to T5, transverse processes of C4 to T5.
I have a quick question. Sorry, what was the highlight on the previous page? Or was it the same page?
For erector spinae or for transversospinalis?
For erector,
The first sentence.
the very first one? Okay.
Very first sentence. The erector spinae group runs from the sacrum to the occiput along the posterior aspect of the vertebral column.
Okay, thank you.
You're welcome. Guys, I love questions, so please, you're never bothering me by asking me questions. I'm a teacher. I love questions. All right, moving on to page 203, we are looking at splenius capitis and splenius cervicis. These muscles are located along the upper back and posterior neck. They are going to be involved in Well, let's look real quick. Splenius capitis. You see how these fibers run at an angle, right? At an oblique angle. That tells me rotation. I also see that on the neck, these muscles are more lateral. That tells me lateral flexion, right? I also see that they are anchored on the posterior aspect of the bone. That tells me extension, right? Because posterior muscles extend. Lateral muscles, we would say abduct if we're talking about an arm, but you can't abduct the head where you only laterally flex the head. So remember, this is why I am telling you this. Look, rotation, lateral flexion, and extension. The actions are listed right here. Most students will try to memorize this. Don't memorize this stuff. Just intuitively understand if it's sticking out, if it's attached to the back of the bone, it's going to be an extensor. If it's on the lateral side of the neck, it's going to be a lateral flexor. If these muscles run at an angle, they're going to be involved in some kind of rotation. Just looking at the shape of the muscle and where the muscle is positioned on the body, I can infer what these actions are going to be. You don't have to memorize everything. If you develop your intuition about this stuff, it will carry you much, much farther than memorization will. Also, memorization leaves your brain once you take the test, right? All that stuff you memorized, it gets dumped. Once you understand how muscles work, I can't take this out of your brain. Once you know posterior muscles extend, it's in there forever. That will carry you everywhere, anywhere you want to go with muscles. So, 2 highlights on this page. It says the long splenius capitis and splenius cervicis muscles are located along the upper back and posterior neck. In contrast to other back muscles that run parallel to the spine, the splenii fibers run obliquely. Highlight, the splenius capitis is deep to the trapezius and rhomboids. Pause highlighting. Its fibers angle toward the mastoid process and are superficial between the trapezius and sternocleidomastoid. Highlight. The splenius cervicis is deep to the splenius capitis and not as easily isolated. Pause highlighting. However, its general location can be outlined in the lamina groove of the upper thoracic and cervical spine. Highlight all of these actions. Unilaterally, when one side contracts, it causes rotation of the head and neck to the same side, ipsilateral rotation, or it laterally flexes the head and neck. When they contract bilaterally, they extend the head and neck. Moving on, page 205, the next group are the suboccipitals. Suboccipital tells you exactly what you need to know. These muscles are just inferior to the occipital bone. So they will originate on the occipital bone and insert at various points on the first 2 cervical vertebrae. So this is a small group of muscles right at the base of the skull. When your client is lying on the table face up, and you bring your hands like this and you kind of find that bony ridge at the base of the skull, you kind of rock the skull. It's a really good way to work those suboccipitals. For the suboccipital group, there are 8 muscles total. There are 4 that we name, and remember, there will be 1 on the right and 1 on the left. So each of these 4 comes in a pair. That gives you a total of 8. Highlight the first sentence on suboccipitals. The 8 small suboccipitals are the deepest muscles of the upper posterior neck. So these guys stabilize the axis and the atlas, and they create intrinsic movements like rocking and shaking of the head. The 4 muscles that we have are rectus capitis posterior major. And wherever there is a major, there will be a minor. rectus capitis posterior minor. So this is the long one, then minor is the short one. Then we have oblique capitis inferior, and wherever there is an inferior, there will be a superior, oblique capitis superior. Now again, you are only seeing one of each. I want you to understand that this is a mirror image from one side to the other. So this one will be here and here, and then this one will sit over top. You got this one on both sides, and this one will be on both sides. There will be 8 total. We just illustrate it like this so you can see where each one fits. Another thing, when I'm telling you guys that these muscles tend to do one thing or another, there's a reason that I say tends to and not always does it without exception, because this muscle that pretty much runs up and down is named oblique. Don't ask me why, we just got to die mad about it. The only other thing that I want you to highlight under the, in the box that tells you all of their actions, I want you to highlight it rock and tilts the head back into extension. I want you to highlight this one. All right, we're going to move on to page 207. The next muscle for us to look at is the quadratus lumborum. Now pay attention, you guys, because this muscle will make you a lot of money as a massage therapist. Everyone in the world has problems with their QL. All right, the quadratus lumborum. The name quadratus tells you it is a 4-sided muscle, right? It's roughly rectangular shaped. Its origin is along the iliac crest. It then inserts onto the inferior aspect of the 12th rib, so from the hip to the 12th rib, and then its medial edge plugs into the transverse processes of L1 through L4. L5 is not involved in this one. L1 through L4. So when we see a quadratus lumborum in position, just like this, if you imagine this muscle shortening, you would envision the skeleton with the 12th rib being pulled down towards the hip. That would pull you into lateral flexion. That is an action right there, lateral flexion. But remember, origin and insertion are roles that we put onto the muscle. The muscle doesn't care what we think. Muscles do whatever they want. So if this muscle were to contract in a way that pulled the hip up toward the rib, then we would be elevating the pelvis. That is another action, hip elevation. This muscle is kind of informally known as the hip hiker muscle, because when you are standing and you start to walk, right before you take that first step, the first thing your body has to do is lift the hip to give your foot some clearance so you can slide forward. If you don't lift the hip, then you're dragging your foot flat across the floor. So to initiate walking, you have to first elevate the hip. This is the muscle that does it. The quadratus lumborum, or the hip hiker, you would think that this is a lower back muscle, especially with the name lumborum, but it is actually the deepest abdominal muscle, which is weird to think about. But it's like the deepest muscle of your abdomen. Stretching from the posterior ilium up to the inferior margin of the 12th rib, and then anchoring itself on the spinous processes of the first 4 lumbar vertebrae. I want you to highlight all of this muscle's actions. It laterally tilts the pelvis. So when you when you stand like this, right, your hips are kind of angled. This QL is contracted, lifting up on this hip. So when you stick, so when you stand like this with your hip all cocked out, all sassy, this QL is engaged, right? It is elevating one hip. That's why you're leaning to the other side, right? You've elevated the hip. Next thing it does is laterally flex the vertebral column to the same side. And when it contracts bilaterally, so when both of them contract, it holds on to the 12th ribs for when you're doing something like forced exhalation. So you take a deep breath in and blow out all your birthday candles. As you blow, the QLs engage, pulling down on the 12th ribs, stabilizing the rib cage as they compress. It's a good muscle. When you are massaging a client, if you can figure out how to get into the QL and really work and loosen up that muscle, you can help a lot of low back pain, especially people that drive a lot or people who sit at computers all day. QL releases, not the most comfortable thing in the world, but oh man, does it feel so, all of this just feels so much better when it's done. All right. Moving on to our next muscle group, page 209, abdominals. The abdominal muscle group consists of 4 muscles, which are kind of wrapped around the abdomen in layers. This is the only bit of structural support that we have over the abdominal region. There are no bones in the abdominal region. We go from hip to lumbar spine to ribs. Like that's it. This is why the belly is such a vulnerable area. So especially when we look at this illustration here, we can see these bandages are showing you the different directions that these muscles are running in. So the muscles of the abdominal group are rectus abdominis, internal and external obliques, and transverse abdominis. Again, let these names tell you something about the muscle. Whenever you see the word rectus, I want you to think rectus means erect, which means up and down. Rectus muscles will always have fibers that run up and down. So when you look at rectus abdominis, you see that fiber direction perfectly running up and down. Rectus abdominis is the one that we call our abs. It gives you that distinctive washboard belly. I don't have one, so I'm not going to show you, but gives you that distinctive washboard belly. Those are the multiple bellies of this unique parallel muscle named rectus abdominis. Next, we have our oblique muscles. Oblique tells you that these muscle fibers are running at an angle, and they occur in pairs. One is more external, one is more internal, hence their name. The deepest of the 4 is the transverse abdominis. Again, transverse means in a horizontal direction. The transverse abdominis runs in a horizontal or transverse direction, wrapped directly across the belly. On page 209, I want you to highlight everything on the second paragraph, starting with the revered washboard belly. Highlight that whole box of text. The revered washboard belly is formed by the multiple superficial bellies of the rectus abdominis. Lateral to the rectus abdominis is the external oblique. Unlike the round bellies of the rectus abdominis, the external oblique is a broad, superficial muscle best palpated at its attachments to the lower ribs. The thin internal oblique fibers are deep and perpendicular to the external fibers and can be difficult to distinguish. Quick refresher, when we say perpendicular, we mean it crosses at a right angle. So they exactly go in the opposite direction from each other. So if the external obliques run this way, internal obliques run this way. Internal obliques. The transverse abdominis, the deepest muscle of the group, plays a major role in forced exhalation. It cannot be specifically palpated. So you can't really feel this one, but trust me, it's there. Moving on to the next page. Rectus abdominis. Now, again, think about where this muscle is in situ, in anatomical position, in its place. Where is this muscle? Starting along the costal cartilage and xiphoid process, so we're starting on the anterior ribs. These muscles converge and insert onto the pubic tubercle. So they are anterior. And we said anterior muscles flex, right? So these are spinal flexors. They flex the spine. If the muscle flexes the spine, this means that it is antagonistic to spinal extension. So rectus abdominis is an antagonist to the erector spinae. They are on opposite sides of the body, right? Erector's in the back, rectus abdominis in the front. They do opposite actions. Another thing that this muscle can do is tilt the pelvis posteriorly. Now, what do we mean by this? Imagine if the role of origin and insertion were reversed. So now we have an origin and an insertion. No, I'm sorry. I got that backwards. Origin, insertion. If we pull up on the hips, right, instead of pulling down on the ribs, what if we pulled up on the hips? The pelvis would rotate, right? Everything kind of rolls backwards, right? Like that. Tighten up your abs. That is a posterior rotation or posterior tilt of the pelvis. All right, so highlight those two actions. Rectus abdominis flexes the vertebral column and tilts the pelvis posteriorly. External oblique. External oblique. Origin is going to be the ribs, 5 through 12, and then inserting along the iliac crest. When this muscle, since it's running in an oblique direction, when this muscle contracts, right? So the origin is here on my right ribs. Everybody put your left hand on your right ribs, right? Imagine your elbow is anchored, just imagine your elbow is anchored to your left hip, okay? So when this muscle contracts, we pull the right ribs toward the left hip. That is a contralateral rotation, right? The right side contracted, but I rotated to the left. The right side contracted, but I rotated to my left. A contralateral rotation. Muscles on one side of the body create a rotation towards the opposite side. I would write up somewhere ERO. ERO. Externals rotate opposite. Externals rotate opposite. They can also laterally flex to the same side, right? So just like I could pull the ribs around to create rotation, we can also pull the ribs down. They will assist with lateral flexion. Now, if both of these muscles contract together, they will flex the vertebral column. Because again, these are still anterior muscles. Because they are anterior, they will flex. Because they are oblique, they will rotate. And another thing that they can do if they just contract bilaterally, but we don't move anything, by tightening up, they pull in, which compresses the abdominal contents. These are the muscles that you're contracting when you suck it in, right? You suck in your gut, you tighten up those abdominal muscles, compressing the abdominal contents. Now this guy's partner in crime is the internal oblique. Its fibers run in the opposite direction. So they start more on the front of the ribs and then attach more posteriorly along the iliac crest. These guys will also assist with lateral flexion to the same side, but these guys will rotate the vertebral column to the same side. So again, think about one hand starting on the hip, inserting on the ribs. When you squeeze your hand, pulling the ribs toward the hip, you're rotating to the same side. So up in the margin somewhere, I would write IRS. Yep, just like the IRS. Internals rotate same. Internals rotate to the same side. If these guys contract bilaterally, again, we pull the ribs down toward the hips. They are on the front of the body. That would be flexion. Last, our little buddy, transverse abdominis. Oh, he kind of starts on the midline and then just runs horizontally, wrapping around. Doesn't really get an action. He compresses the abdominal contents, so like when you suck it in, he tightens up. Other than that, he doesn't really do much. All right, moving on. Page 213, next muscle we're going to look at is the diaphragm. All right, starting at the top, I want you to highlight the first sentence. The diaphragm is the primary muscle of respiration and is unique in both its design and function. The diaphragm is not like any other muscle because it has a special job to do. And when you give something a special job to do, it will look different because it gets different features to do that job. We've seen this idea over and over and over again in anatomy, right? So when you think about the diaphragm, I want you to imagine an umbrella, right? When you put out your umbrella, right? So your umbrella is open. You grab the handle and you have to pull down to close the umbrella, right? You guys following me here? You pull the umbrella to bring it down. If you don't latch it, when you let it go, when you relax the grip, the umbrella pops back up, right? This is how the diaphragm works. You have a dome-shaped muscle. It is a thin, umbrella-shaped muscle. So it is not large like this. It looks like it's big like a liver or some kind of organ. This is a thin muscle shaped like a dome. When the muscle contracts, it moves downward. Just shush. When the diaphragm contracts, it moves downward, just like pulling down on the handle of your umbrella. But when you let it go, the umbrella pops back up to its neutral position, being up there. Now, the diaphragm works just like that. So its broad umbrella-like shape separates the upper and lower thoracic cavities. Highlight the diaphragm's muscle fibers attach to the inner surface of the ribs and the lumbar vertebrae and converge at a central tendon. So this muscle, when it contracts, because its superior surface is anchored to the pleura. I know we're doing a throwback. The pleura is the sac that the lungs are contained within. So if the superior aspect of this muscle is attached to the pleura, when this muscle contracts, moves downward, it pulls down on the lungs, opening the lungs, pulling air in. So this muscle is the primary muscle associated with breathing. This is the muscle that triggers inhalation. When you exhale, this muscle relaxes. So just like the umbrella, when the muscle relaxes, it rises up, raising the floor of your lungs, squeezing the lungs, pushing air out. So we contract a muscle to inhale, we relax a muscle to exhale. if the diaphragm begins to spasm, right? Every muscle has the potential to develop spasms. The diaphragm is a muscle just like any other. So when the diaphragm goes into spasm, it quickly contracts and pulls on the lungs. This causes the lungs to quickly and suddenly pull air in. That is a hiccup. It's quick spasms of the diaphragm muscle. I want you to highlight the two actions of the diaphragm. Draw down the central tendon of the diaphragm and increase the volume of the thoracic cavity during inhalation. Couple of fun facts. So we do have this umbrella-shaped muscle, but remember, there are very important things that need to make their way from the chest down into the abdomen, like the inferior vena cava or your esophagus, right? You gotta get food down there somewhere. So even though this is an umbrella, it does have a couple of natural holes in it to allow passage of certain things. Here we see the foramen, which just means hole, the foramen for the vena cava, returning blood to the heart. We have the esophageal hiatus. This is a natural hole where your esophagus pokes through so we can get food from up here down into the stomach. We have the abdominal aorta, main artery carrying blood down, bringing blood to all of your abdominal organs, hips and legs. I just wanted to point that out, fun fact. All right, we're not making bad time. All right, moving on to page 215. Page 215, we are looking at the intercostals. With a name like intercostal, we are telling you exactly where to find us. Inter means among or between. Costals are the ribs. The intercostal muscles are found among or between the ribs. All right. Intercostal muscles occur in two layers. One is more on the outside, the external intercostals. One is more on the inside, the internal intercostals. These two muscles do separate things. If you have ever eaten ribs, you know what we're talking about, right? You ever eaten like pork ribs or something? You've noticed that the rib meat comes off in like two sections. Those are the internal and external intercostals. Anytime you've eaten ribs, this is the muscle that you're eating. These guys, their main function is to help stabilize the rib cage, and they assist in respiration. So the external intercostals, I want you to highlight both of these, but I'm going to explain them a little bit. The external intercostals draw the ribs superiorly. So remember when we talked about inhalation, we said the diaphragm contracts, pulling the floor of the lungs down. Well, when the external intercostals contract, they grab the ceiling and lift the ceiling up in a superior direction. So if you are a lung and suddenly your floor drops down and your ceiling raises up, as your volume increases, you pull air in, just the way a bellows works. If you've never heard of a bellows, do a Google search. If you've ever watched Bugs Bunny, you'll know a bellows when you see it. You pump air into a fireplace. When you pull open the bellows, it pulls air in, right? So we do the same kind of thing with our ribs and our lungs. You drop the diaphragm, you raise the rib cage. By expanding the volume, we pull air in. Now, when the diaphragm relaxes, it raises back up, right? So we start to squeeze the lungs, pushing a little bit of air out. But in the event that we need to forcefully exhale, like blowing out a birthday candle or trying to blow out something else that's on fire, whatever. Now the internal intercostals will come into play. Internal intercostals pull the ribs down or inferiorly. So again, if the floor raises up and the ceiling lowers down, you are reducing the volume in the lungs, squeezing them, forcing air out. So these muscles assist with respiration by either lifting or lowering the rib cage. Those are the externals and the internals, respectively. Please make sure you highlight both of the actions. External intercostals draw the ribs superiorly. Internal intercostals draw the ribs inferiorly. All right. Good stuff so far, you guys? Everybody good? Okay. The next muscles that we're going to look at are serratus posterior, superior and inferior. Again, this is, if I were paid to go through the body and name everything, this is exactly how I would do it. I love names like this. It makes so much sense. It's brilliant and I love it. Serratus tells me something important about the shape of the muscle. Note the distinct serrated edge, right? Just like a serrated knife. Posterior tells me these are going to be found on the posterior side. Best not to overthink these things. Superior tells me that it's going to be closer to the top. And if I'm going to put the name superior in it, right? If there is a superior blah, 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 there will be an inferior blah, blah, blah. If there is a lateral something, something, there will be a medial something, something. If we're going to use directional terms in the name of the thing, there will be a counterpart with the opposite name. So if there is a serratus posterior superior, there will be a serratus posterior inferior. Let me take that one step further. If there is a serratus posterior, there will be a serratus anterior. Bet your money on it. Serratus posterior, superior and inferior are sandwiched between shoulder muscles and the erector spinae group. These two broad muscles only move the ribs. That's all they do. Now, if you want to know how they move the ribs, of course, we could read and make flashcards and try to memorize, but I don't want you to memorize. I want you to develop an intuition about muscles. Look at these muscles with me. Do you see how these muscles run in a downward direction? These muscles run in an upward direction, right? We see this? A muscle will always pull its insertion toward the origin. Origins are always the least movable or the more stable attachments. So, if this muscle is originating on the spine and it runs downward in an oblique angle, it will pull the ribs up in this way when it contracts. This is lifting the ribs. This will probably have something to do with breathing because the only thing that has any business moving the ribs is something related to breathing. So, serratus posterior superior. Its only action, elevate the ribs during inhalation. What do you know? I didn't even have to read the thing. All I had to do was look at the muscle, and I took a good guess. What does this muscle probably do? It definitely pulls an insertion towards an origin. But since this muscle runs like this, when it grabs its insertion and pulls, it is going to lift the ribs up. Do not memorize all of this stuff, guys. It is way too much. Developing an intuition is my secret. That is my gift to you. Do you guys seriously, as much as I know about this stuff, do you think I memorized all of it using flashcards? No. So, again, origin, insertion. Now this muscle is reaching upwards. When this muscle reaches up, grabs the ribs and contracts, it will pull the ribs downward in an inferior direction. Depress the ribs during exhalation. Guys, this is the secret to learning muscles. This is the trick to how it's done. If you are a flashcard person, I want you to make 1,000,000 flashcards, but I want you to understand memorization will not carry you very long. You can memorize something for a few days, maybe a few weeks, but you'll lose that information. It just falls right out of your brain. Understanding and developing an intuition about muscles, that is the way to go. Because if you can look at a muscle, you look at its direction, what it's attached to, where it's positioned on the body somewhere, and you can just from your gut just say, looking at that muscle, based on where it is, looking at its shape, the direction it's in, I think it's gonna do, but that's how you do muscles. That's the secret to learning all of this information. All right, good stuff? Good stuff. The next muscle group, another one of my favorite words, I love this word, intertransversarii. Intertransversarii. As the name implies, these small, short muscles span between the transverse processes. So, when you're looking at the vertebra from one transverse process to the next. Boop, 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 boop. Tiny little muscles. Now, don't look, don't look, don't look. Think about this, okay? Think about this. If we have muscles on the spine and they are lateral on the spine, when these muscles shorten, it will cause the spine to curve. I'm trying to get my directions going. There we go. If these muscles shorten, the spine will curve toward that same side. This is lateral flexion, right? But if both sides of this muscle contract together, they pull the spine backwards into extension. So unilaterally, lateral flexion, bilaterally, extension. Develop that intuition, guys. Now, you may notice that I am not spending a lot of time talking about origins and insertions. I only want you to know origins and insertions for very important muscles. Guys, I promise you, I'll put $5 on the table. You will never in your career have a client come to you and say, oh my God, I need a massage. My intertransversarii is messed up. That is not a thing. If someone is coming to a massage therapist, it's gonna be for a major muscle, right? Not something like this. I don't want you bogging down your brain, having to learn C2 to C7. No, major muscles, we will learn. Little muscles like this, little muscle groups like the multifidi, rotatories, no. So if we have intertransversarii, little muscles that run between transverse processes, the next group is the interspinalis. Same kind of muscle, except these guys run from one spinous process to another. As far as vertebrae go, this is about as posterior as you can get, right? This is like the most posterior muscle attaching to a vertebra. Also, look, these fibers run straight up and down. There is no oblique angle. If there's no oblique angle, then there's no rotation. If it's just on the posterior side of a vertebrae, all it will be able to do is extension. All right, moving on. Oh, that's it. One more thing. One more thing that I really want to make sure that you guys are aware of. The thoracolumbar aponeurosis. And you're gonna say, oh, wait, what, did you just cast a Harry Potter spell on me? Yes, but that's beside the point. Thoracolumbar aponeurosis. An aponeurosis is just a tendon. That's all it is. It's just a tendon. But when we say the word tendon, we are talking about something that is shaped like a rope or a cord, right? It is a cylindrical, kind of round piece of tissue that connects a muscle to a bone. And aponeurosis is a tendon, except it is a tendon that is shaped like a flat sheet of paper instead of like a rope. So it's made of the same material. If you were to take a piece of a tendon and a piece of an aponeurosis and you stick them under a microscope and you look at them, they look identical. It's the same kind of tissue. We just give things different names so that we can talk about them. But remember, the body does not give a crap what we call it, right? A tendon is a tendon is a tendon. The body just does its thing. We are assigning a new word to a tendon that is flat like a sheet of paper. Thoracolumbar tells you where we are. Thoraco or thorax, lumbar. We are running from the thoracic spine. This is the origin of latissimus dorsi. We are overlaid by the lower trapezius muscle. Then into the lumbar spine along the borders of the sacrum and the lumbar transverse spinous processes. This is kind of a diamond-shaped tendon. It's easy to palpate. It is responsible for a lot of the stability of your lower back. Several muscles will originate off of it, but it is a very important structure. You guys should be able to identify it. True, it is not a muscle, right? It is not a muscle. But it's still something that I want you to know. And again, guys, I know I'm like breezing through these, but this whole slideshow is online for you guys to see. And another thing that I will tell you is really, like, even though these aren't diagrams you'll see on a test, right? These aren't diagrams I'm going to quiz you on. But what I really want you guys to do, since you got nothing but time on your hands and so much material to study, I really want you to give these diagrams a few minutes of your attention. Just look at them. Look at what you're seeing. We've taken these vertebrae, we've cut off the backside so that you can see how these muscles are going to be laid around these joints, right? These will give you clues as to what it is that you're looking at. We cut off the body, so now you are looking into the vertebral foramen, right? Diagrams like this go a long way into helping you develop a mental map of the body, figuring out mentally where things fit, why we have certain superior facets where we have them. It helps you visualize where these things connect to each other, how muscles wrap around those joints, kind of where it all fits. All right. Well, guys, that is everything I had. Thank you for coming to my TED Talk. Do you guys have any questions over anything that we have gone over? I know I just dumped a lot of info on you guys. I understand that. Pay attention to MindTap. Again, I will be uploading certain activities for you guys to do. But I am not going to unlock the test until I really feel like we're good. Now, we're not going to sit here for a month on this stuff. You don't have that much time. But I did feel, once I'd slept on it, I did feel like setting that test to be due on Sunday was just not enough time. I felt in my heart like it wasn't enough time. If you guys are feeling confident by the end of the week, I'll put the test back up. But I feel like it's going to take today's lecture, Thursday's lecture, and then probably next Tuesday's lecture before we are good. Let me see, I got Lois, chapter 4. Lois, I don't follow. Is that a question or? I'm sorry, I don't, what about chapter 4? for this material, yeah, we're in the trail guide. We're in the trail guide, boo-boo. If you look along the spine, we're in this yellow section, spine and thorax. Oh, Coral, my pleasure. Oh, it's my pleasure. One thing that I will just another tidbit to throw out there. When you're learning about muscles and you're having to learn what their actions and stuff are, it becomes very, very important that we really, really know the actions of the body. So before you jump into the details of the muscles, what I would do if I were studying this stuff is I would the first thing that I'm going to study, even if I know them in my heart, I'm going to go back to body movements, right? Flexion, extension, rotation, abduction, adduction. I'm going to relook at supination, pronation. Remember, holding the soup and pouring it out, supination, pronation. I would go back to, guys, our next topic, we're going to look at the face, which means jaw movements. So I would go back to movements of the jaw, right? Protrusion, giving yourself an underbite. Protrusion, retrusion, like pulling the jaw backward. Elevating the mandible. So when your kids won't shut up, you say, hey, elevate your mandible, child. Depression of the mandible. I would go back to, I would start back with body movements, because once you clearly 100% you know the movements of the body, then it's easier to come through here and say, oh, well, that would be lateral flexion, or that would be, pronation of the arm, or whatever it is. And again, guys, it takes time. This is not an overnight thing. This is not a, like, let me binge for a few hours and I'll know all this stuff. It takes time. But as you're learning each muscle, stand up and palpate it on yourself and move your body and feel the muscle contracting. Make it in your head that I know this muscle is a real thing. It really exists on my body. I can feel rectus abdominis. I can feel external oblique when I rotate to the opposite side. Make sure that you are creating as many connections in your brain, right? You're touching it, you're reading it, you're saying it, you're doing this over and over and over again. You're linking touching the muscle with a body movement, right? I touch the deltoid as I abduct. I touch the anterior deltoid as I flex. Touch the anterior deltoid. Now touch posterior deltoid. These do not feel the same. One is contracted, it is firm. The other one is loose and flaccid, right? Connect these things in your mind. The muscle that you're touching, the action that you are performing, where the muscle is on the body. Look at the picture, see the muscle fiber direction. Let that be how you study muscles, because I'm telling you guys, flashcards are amazing if you need to learn something for a week or two. Muscles never go away for a massage therapist, you guys. Muscles is what we do. Muscles is what you need to know. I know we've gone through every organ system, right? We talked about nervous system and we did endocrine system and all this. I get it. But guys, muscles is what you got to know. Forward, backward, inside, and out. You do not get there memorizing every detail on flashcards. You get there by developing that intuition. You understand where the muscle is, you understand what direction it goes in, you take a good guess. Actions of muscles are not randomly assigned. The action of the muscle is based on where it is, what it is shaped like, what direction it's going in. If you learn to speak the language of muscles, you don't have to memorize anything. You look at the muscle and you read the information from it and you can tell what that muscle does. It really does help. It really, really does help. Okay, keep your eyes peeled for more activities on MindTap. Reach out to me with any questions. All right, you guys, I don't get a lot of students asking me questions, so I feel like you guys aren't taking advantage. Pick my brain. If you guys have questions, shoot me an email, shoot me a text. Otherwise, get in touch with me, smoke signals, something. Get in touch with me and I'll get back to you as soon as I possibly can. but I'm here for you guys. I know that it's a lot of material. I know that it's a lot of studying. I wish we could do this in person. It works a lot better that way, but blame it on the Rona. Okay. If you guys don't have any more questions, we can go ahead and wrap this up for the day. This lecture will be posted on MindTap soon. And since we switched to Zoom, my video recordings actually are recording videos now. Who knew? So this video will be on MindTap. The PowerPoint slideshow is on MindTap. And keep your eyes peeled because I've got a few more projects in my head that I'm going to write out and put on MindTap as well. So we're all good? Good stuff?
Thank you.
Good stuff.
My
Thank
pleasure.
you.
My pleasure. Have a good afternoon, you guys. I will see you Thursday.
All right, you too.